Let's see if we can get one more call in here,
Okay.
or two maybe. Let's go to Matt in Boston. Hi, Matt.
Hi, I wanted to know how you feel about the new Massachusetts insurance law where you lose a tax credit if you don't have health insurance right now.
It's bad. It's not good. The Massachusetts plan is an attempt to say that a human being is like an automobile. This is not. There should be no private insurance involved in our health care. You cannot ever have the question of profit or bottom line being asked when we're going to try to heal someone. A doctor or a hospital should never have to ask that question. How's this going to affect our bottom line?
Do you believe there's enough money to really support a national health care system?
Oh, absolutely. First of all,
But we'd have to change the tax system entirely, it would seem to me.
Well, no, not entirely. The first thing we would do is just by not wasting so much money with private insurance. I mean, we waste close to $400 billion a year in administrative costs. 15 to 20% of HMOs and private insurance of their budget goes to their administrative costs, red tape, their own red tape, not the government. Medicare, Medicaid is 3% overhead compared to 20% in these other companies. These private companies. A doctor should never have to leave the examination room that he's in with you and say, excuse me. You know how they always say, excuse me? And then they have to go down to the little glass room where they have 6 or 7 people now sitting there on the phone yelling at HMOs and ask an insurance man for permission whether or not your own doctor can refer you.
I think it's interesting. I think there's a lot of people in the United States that agree with what you're saying and probably agree with a lot of what you're saying in the film, but it still seems like we don't quite have the will to change the system either.
Well, because we're afraid of the unknown. We don't know what's going on, and we're afraid of being taxed too much. But people in these other countries, they're taxed a little bit more than us, but we end up paying more because we pay so much in insurance premiums and insurance costs and medical, co-pays, deductibles every year. When you add all that up, plus the other things that you get help with in these other Western countries, like college education and daycare, you add all that up, we actually end up paying more. We just don't call it a tax. We call it insurance.
Of course, in France,
premiums.
they're actually working to reverse the system now. I mean, they're...
Well, the new president is going to try to do that. But remember, Chirac said he was going to do the same thing, too. The French people ultimately are not going to change what they've got. And I hear the music coming up.
And that means we have to go,
we
Michael.
have to go. Well,
and I'm
thank you.
sorry we can't talk longer.
Oh, no, that's okay. Can I just say hi to my wife, who's with all her crazy quilters listening right now there
Absolutely.
in northern Michigan.
Good talking to you, Michael Moore.
Thank you very much.
You're listening to Talk of the Nation from NPR News.